What is the BeautiFill laser lipo procedure? Most people have heard of liposuction. It's basically where you are physically removing the fat out of someone's body. Um, Contrary to popular belief, liposuction procedures are not really for weight loss. They are really more contouring type procedures. So someone who's been working out, exercising, watching their diet, and they have some areas of stubborn fat around their belly, midsection, flanks, whatever it might be, liposuction is the treatment for you. Now, that being said, what is BeautiFill? BeautiFill is a proprietary laser lipo procedure. And what it actually amounts to is whenever we remove fat from the body, you leave gaps, you leave spaces. And that space is what your skin has been contoured to. And so it's basically, when you say BeautiFill, you're saying a laser lipo type procedure where basically you're combining laser treatments with liposuction procedure. Now, the way the lipo procedure works is there are two forms of lipo procedures, okay, or liposuction procedures. One are the ones that are performed under general anesthesia, which are done in the hospital. From our perspective, we don't necessarily recommend that, primarily because one of the biggest side effects, one of the biggest complications that can come along with liposuction procedures is the fat embolism. It's where you develop fat, or fat finds its way into a blood vessel, and it wreaks havoc within wherever it goes. The main reason people get those complications is because they are under general anesthesia. The underlying cause for fat embolism is when the cannula that is used to remove the fat is actually jabbed into the muscle tissue. When you do general anesthesia, the individual or the patient is unable to tell the physician if or when that cannula is in the muscle tissue. Now, when we do BeautiFill, the procedure is actually done with the individual under sort of pseudo-conscious sedation. And what I mean by that is they are actually awake, they're talking to us, but they just don't remember much of it, okay? So that keeps us automatically out of that arena where basically I'm going to inadvertently put a cannula or a catheter into the muscle tissue, because when I do, or if I were to do that, the individual would be able to tell me immediately. Okay, so that keeps me out of trouble. Now, that being said, because the person has some form of conscious sedation, they are, again, able to talk to us, but they don't ideally remember much of the procedure. Okay. Now, what happens in laser lipo procedures? Well, basically what happens is that, depending, say we are doing someone's midsection, after making sure the individual is properly sedated, we actually will numb the skin at certain locations, and we'll put a small little incision there. Okay, that incision is where we actually will start to introduce a catheter, where we will actually start to numb up the tissue underneath the skin. That's what allows us to do the procedure without any actual discomfort. Now, once we and again, the way we numb up the tissue is we actually will inject numbing liquid into the tissue. It's a procedure or technique called tumescent anesthesia. It's where we actually will inject liquid into the tissue, and then liquid has numbing medicine in it that will actually start to numb out the surrounding tissue. Once we've covered those areas that we are about to treat, that's when the liposuction actually begins. Now, when we do the lipo procedure, when we actually introduce the cannula that actually will remove the fat, that cannula has built within it a laser fiber. And basically, when we do the procedure, we are actually at times firing that laser, which then allows us to not only break apart the fat to some degree to make it easier to remove, but also allows us to heat up the tissue, the skin. Because when you heat up the skin, because when you're removing fat, you want the skin to contract, to pull back in. The laser lipo procedure, the laser component of it, allows the skin to retract and pull back in, so you get more of a tighter contouring effect as far as that goes. It uses your body's natural reaction to heat, because when you heat up collagen, which is found in your skin, the collagen will naturally contract, and that brings the skin back in, so you don't get all the saggy skin when you remove excess fat. So we essentially use laser lipo type procedures for body contouring. So if you're trying to again remove any stubborn excess fat around the belly, around the flanks, around the back area, bra line, sometimes around under the neck, on the arms. All those areas can be treated by removing the fat that is keeping those areas in a position where it's not something that you really like. Now, once the procedure is completed, the key to the procedure afterwards is what they call compression garments, wearing garments that actually compress the tissue back onto the skin. The reason for that is when any lipo procedure is done, you're essentially separating the skin from the muscle. And so what you don't want is you don't want to allow that skin to shift. That's why wearing compression garments that will take that tissue and compress it against the muscle is what determines the ultimate outcome. Fat can very easily be removed, but you're trying to develop a smooth skin quality, and again, give the skin time to properly re-adhere back to the muscle tissue. And this process can take at a minimum 6 months, if not, I'll tell you 12 months. You would want to wear the garments pretty much on a daily basis, as much and as long as you possibly can, to maximize the results as far as it goes. Of course, there are other restrictions that we typically will put on people depending on the location or the body part that we're actually treating at that time.